Eket walk past them. Some whisper, some even laugh, others look away. But no one stops to ask, why are there so many mentally ill people on our streets? This is Eket. This is reality. Eket is now grappling with a growing mental health crisis. Mentally ill individuals roam the streets, abandoned, untreated, even forgotten. Rising poverty means families can't afford treatment anymore. Many of these people once lived with us, but some looks like they were brought here from other states. Where is the Ministry of Health? Where is the Ministry of Women Affairs and Social Welfare? Why are our brothers and sisters left to rot in public spaces? Is it really the hospital itself? Or do we have other persons that are supposed to play a role but have decided not to or have failed to take their responsibility? These are not ghosts. They are sons, daughters, uncles, sisters. They deserve care. They deserve attention. And we as a people must not stay silent anymore. Let's fix this case. We cannot have people that are mentally ill in the psychiatric hospital and even sleeping on the bare floors. Some of them don't even have what to eat. Some of them are abandoned by their family members over there. It's a time for us to get into the conversation as we will look at some other details and who is responsible for all of this when we talk about the mentally ill persons on our streets. Now, let's get started. Good day to you. Thank you so much for joining again this time around. I go by the name Peters Buhari, and this has got to be the Citizens Assembly. Eyes on Eket, Akwa Ibom State again. So, I don't know if you've ever been in a situation where you have someone who can no longer relate with you the normal way. Have you ever been in such a situation where you've got a family member, a loved one, that can no longer relate with you the normal way? How do you feel? So it looks more like in Eket local government currently, we've got lots of persons on the streets. We've got lots of mentally ill persons on the streets. And it brings about the question of what really went wrong. How did Eket get to this level that we've got lots of mentally ill persons on the streets? Before even going deep into that, the psychiatric hospital located in Eket is the only government-owned psychiatric hospital in Akwa Ibom State, owned by the state government. And not until 2020, that was in about 5 years ago, when the Udom Gabriel Emmanuel administration were able to do something about the state of the psychiatric hospital. It was the worst. It was a place that you wouldn't even want to enter. And now, even at the current state, it's still really of concern, with over 60 inpatients at the psychiatric hospital. Is still an eyesore. An eyesore in the sense that even the money allocated to the psychiatric hospital a year in the budget has remained fixed on 6 million naira every year. And most times, even the 6 million naira allocated to the psychiatric hospital is not even paid in full. So the question is, why will the government allocate only 6 million naira for psychiatric hospital, the only state government-owned psychiatric hospital in the state? And we know how important the psychiatric hospital is, because it helps in the rehabilitation and the treating of some mentally ill persons. So now, let's get into another conversation. How many nurses do we even have in the psychiatric hospital? That question that needs to be answered. Because normally, it should even be one nurse to one mentally ill person. But it looks like we're having one nurse to about 4 or 5 persons. And now, even if you want to deviate from that angle, there are even persons that work one person a shift. So for about 8 hours, you're confined with mentally ill person. About 20 or about 50 of them, just one person. So it's really of concern that the government of Akwa Ibom State will allocate only 6 million naira for a hospital for a whole 1 year. So if you want to break down 6 million naira, that means the hospital is supposed to spend 500,000 naira a month. Then if you want to bring down your calculation again, it means the hospital should spend just in the region of about 40,000 naira a day. And now you want to break it down further when you've got over 60 to 80 inpatients, then it means the hospital should spend about 400 naira on a patient a day. One patient, 400 naira. And the question is, what can 6 million naira do for a psychiatric home? So it's also of concern that some family members are not also helping the case, because there are reported cases that most times when these patients are being brought to the psychiatric home, they are being abandoned by their family members. Just of recent, we heard a lady actually died and was even abandoned by the family in the psychiatric home. So when families bring these mentally ill persons to the psychiatric hospital, what's their aim of bringing them to the hospital? Is it to bring them back? Is it to get them treated? Is it to bring them back into the society? That's the question that some family members need to ask. And now let's move over to what we are having currently in Eket local government. When you walk around certain streets, you're seeing a lot of mad people. There are times when you pass through Eket and it seems like there are new mad persons in Eket. Yes, I like to use that term, new mad persons, because it looks like new set of mad persons have been brought to Eket. Because most times you see these persons walking on the streets. There are mad persons that you see on the street and they'll be like, someone could even tell you, oh, this one, we know him, he's been here already. But there are persons that are currently walking on the street, mad persons walking on the street, that persons don't even know them. And after a while, we see new mad persons in Eket. Is Eket now a dumping ground for mentally ill persons on the streets? What is the government doing to tackle the rate at which you're seeing a lot of mad persons walking on the streets? To be precise, Eket. Or is it because Eket local government harbors the psychiatric hospital? Is that why we have a lot of mad persons on the streets? So the government needs to turn their attention to the psychiatric home. How much are the nurses paid? Is there money paid for hazard? So it may surprise you to know that only 3,000 naira has got to be the amount paid to nurses a month for hazard. I said 3,000 naira. How would you pay a nurse that is working in a psychiatric home 3,000 naira a month? 3,000 naira a month for hazard. So it's time for the government to also stand up and see what we can do to the psychiatric hospital, what we can also do to the persons walking on the street. And this one goes out there to the young ones. Drugs, substance abuse can lead to mental issue. Reports has got that over 80% of the current inpatients in the psychiatric home found themselves there because of the abuse of substance. It's not just about the male, the female are also involved. And also depression leads to mental issues. So what you cannot solve, you just have to leave it. So we hope that the government can turn their attention to the psychiatric home, not just the inpatients, but also the nurses. Because we cannot even be compared to other psychiatric hospitals around this particular end. Let's see what can be done. For the fact that they are mentally healed doesn't mean that they should be forgotten. Thank you so much for joining me on this segment of the program where we got to talk about the psychiatric hospital and the number of mentally ill persons we have got in the streets of Eket. I remain Peters Buhari, and for now, I take a bow. God bless you.